There are people in Paterson who need to heal. There are people in Paterson who need help. And that's what this ambitious program aims to do, RealFix. In fact, it was 3 years ago when the gentleman to my left, our Chief Innovation Officer, Edward Mosey, walked into my office and said that Michael Bloomberg, through his philanthropy, is issuing a global mayor's challenge. And the challenge was to any city in the world that could come up with an innovative idea to address a long-standing challenge only exacerbated by the pandemic. Michael Bloomberg, if the philanthropy felt like that was an appropriate action item, would give that city $1 million to implement that innovative idea. 631 cities around the world applied for this opportunity. Bloomberg Philanthropy selected 15 cities out of the 631. One of those 15, the city of Paterson. Opioid use disorder is not exclusive to us here in Paterson. It is a global challenge. That's one of the reasons why we were selected to address it. What is often said by our Chief Innovation Officer, Ed Mosey, is that drug dealers are very effective. What if we were better than drug dealers? Very often the individuals that are addicted to these opioids, whether it's fentanyl, heroin, those are just the fake fix. When we have to revive anyone with Narcan, that's a quick fix. But what is the real fix? The real fix is medically assisted treatment, Suboxone, Council President, Suboxone. And how this works, we've established a hotline, 833-REAL-FIX. And in order to be eligible for this opportunity through Bloomberg Philanthropies, we piloted the program. 5 individuals struggling with opioid use disorder called the hotline, 833-REAL-FIX, and we promised them that we would get a medically assisted treatment to them within 90 minutes. So they call the hotline, a teledoc will respond, prescribe the medication through a local pharmacy, and we'll get that to them. Well, we didn't do it in 90 minutes, we did it in 76 minutes. So we under-promised and over-produced. But it doesn't end there because the RealFix has to have a real long-term solution. So we connect them with counselors. It's been over a year since we received $1 million, and Ed Mosey, to his credit, has been able to staff up. We were able to scale up the program. And to date, and he'll delve deeper into the details relative to the number of people we've helped and the number of people we've healed, 339 people as a part of the RealFix program have received treatment. A number of them were homeless. About 122 now have a roof over their heads. I'm going to give you one example. Jose Ortiz, a homeless man who's been on the street for 13 years, suffered from diabetes, unfortunately could not get treatment because the shelter would not accept him. And he didn't even have ID, something as simple that we can take for granted, identification. Well, unfortunately, because he couldn't get treatment, he lost both of his legs. He was double amputee. But thanks to RealFix, he is no longer homeless, and he is healing and getting the help he needs. Here in Paterson, we are profoundly grateful to have Ed Mosey. That position, Chief Innovation Officer, Pat, never existed. But back in 2018, when I was selected as one of the 40 mayors by Michael Bloomberg to participate in a year-long program known as the Bloomberg Harvard City Leadership Initiative, after I completed, I was asked by a local philanthropic foundation, what was the takeaway? And I said, I need a Chief Innovation Officer because we want to do things differently in Paterson. The definition of insanity is doing the same thing over and over again and expecting different results. We're getting results. We're not doing the same thing anymore in Paterson. It's divergent thinking. It's innovative thinking. And thanks to this $1 million, hopefully we can help thousands of people in Paterson that really need to heal. So at this time, I'm going to yield to the aforementioned Chief Innovation Officer, Edward Bosey.
Good morning. So just going to give some statistics here. So as of May 30th, we've really started in earnest about last February. We started staffing up with team members. And as of May 30th, we've had 339 individuals admitted into medication-assisted treatment. I'm not talking about a referral, like this is a good place to call. Why don't you call them? Why don't you get yourself there? I'm talking about placed into treatment with a telehealth provider or transported at no cost to them through a private car service into treatment. So again, when necessary, that can happen in as little as 90 minutes. And 2 points, that medication is important because it prevents withdrawal, it prevents overdose, and it prevents cravings. The 90 minutes is important because if we can't get them the medication before they need their next fix of opioids, we've left them with only one choice, and that is the illicit opioids. So our objective was to make the medication to counteract addiction faster, easier, and cheaper to get than illicit opioids. And I have to say, we've succeeded. We've placed those 339 people into treatment, 270 of them are housed, most of them connected via telehealth. Just over the phone, appointment with the doctor, delivery to their homes. You know, you can just sit on your couch and the next knock on your door will be the medication. Simple as that. And then we introduce you to a behavioral health counselor because medication and counseling go best together. 122 were homeless. Let me say that our objective in the beginning was, in our city, we had identified 150 street homeless people, about half of whom admitted to having a substance use disorder. We set the audacious goal of treating 75 of them in the next 3 years. We've admitted 122 into treatment. 33 of them are now permanently housed. There could be additional that we made possible for their families to take them in. That's a 27% success rate. The national average is 15%. We are crushing it. We are blowing that away. We are showing that this model of making assistance available on demand, in real time, is the game changer. Now, studies will show, as far as we talk about cost effectiveness, we only spent about half of that $1 million Bloomberg grant. But studies show that over a lifetime, if we get somebody into medication-assisted treatment, we can save taxpayers as much as $105,000 per individual in medication-assisted treatment. So highly, highly cost-effective. There's other studies that show that for every 2 people we get into medication-assisted treatment, we save 1 life from premature death. So I will let you crunch the numbers, but this is an extremely cost-effective methodology that we expect to go beyond Paterson. We are speaking with the county, we are speaking with the state about how to take this further. This week, we're ramping up. So big announcement, this week, RealFix goes 24/7. You can call 24 hours a day, 7 days a week. If you need to be placed into treatment within 90 minutes, we will call to place a treatment advocate that will make that happen. So for those in Paterson, we invite them, please stop suffering in silence. There's no need. Your assistance is here on demand. Call 1-833-RealFix. That's 833-732-5349. Let's get you started on treatment before you need your next fix, because we have the RealFix, medication to assist treatment for opioid addiction. Also, just 2 notes, we invite doctors that want to join our program, that are willing to take appointments by telehealth. Call 833-RealFix. We will fill your calendars. We will make your practices profitable to the benefit of the clients that we both serve. Also, for those that would like to become one of our patient advocates, we're looking for 1 individual that's either a social worker of substance abuse or a peer recovery specialist to join our team, full-time position. We really, really need that, and I hope that that makes your news story, because that help is considerable. That's all I have. Thank you.
Ultimately, we'd like to serve as a model municipality for other cities to emulate stated earlier, this is not a challenge exclusive to Paterson. There are cities in New Jersey, cities across the country that have individuals who are struggling, who are suffering. And Ed is often fond of saying that time is of the essence. And let me elaborate on that. I'll unpack that statement. It's as if someone's hungry, and if you order a pizza, and that pizza does not get there within a certain amount of time, you'll just about eat anything. When you have an addiction, and you can't get the medically assisted treatment, you may revert to unsavory activity. So that's why we say time is of the essence, and that we have to get that assistance to those individuals as promptly as possible. At this time, we've been joined by 2 members of a municipal council who strongly support this program, who are definitely boots on the ground representatives and know what the challenge is, the enormity of it. We'll hear first from our council president, Alex Mendez. Thank you.
Yeah. Thank you, Mayor. 866 RealFix is working in the city of Paterson. We'll be facing a tremendous challenge. And as we heard before, out of the total number of patients, almost 50% are homeless in our community. We have a serious situation where homeless, addicted, and we have this program. This program is working, and I'm so pleased to hear that we're gonna move 24/7 with this program. Every person in the community needs to know about this information, need to know this number, to encourage those people that are suffering, to let them know that we have a program, that is working in the city of Paterson to get them back into the community. And what I'm more excited about is to hear the program right after. And it's a continuation that they're getting into specialists with counseling to make sure that they get back into the community and not go back into the street. I'm very pleased to hear this. This governing body is in full support of this program, and we're going to continue working in collaboration with administration to encourage every person in the city of Paterson to let everybody know that we have a program that will take you back into the right track in our community. Mis amigos, este es un programa muy especial y muy importante. Tenemos muchos problemas de adicción en la ciudad de Paterson. Tenemos muchos hombres que están en la comunidad con problemas de drogadicción y no saben que hay un programa que está trabajando en la comunidad. Y es por eso que este programa tenemos que promoverlo en la ciudad de Paterson, para asegurarnos que esas personas indigentes que están en la calle puedan llegar a un lugar donde puedan ser realmente sanados de la adicción y puedan ser regresados a lo que es la comunidad, a lo que es su familia. Así que estamos en apoyo completo en este programa. I want to take this moment to thank the Bloomberg Foundation, Mayor, for this tremendous grant, $1 million that is helping the city of Paterson tremendously. Let's continue moving the city forward. Thank you, Mayor.
Council President thanked Bloomberg Philanthropies 2 weeks ago, unrelated. They invited me to the City Data Alliance. I was the only mayor from New Jersey. And as you know, when Michael Bloomberg was mayor for 3 terms, he focused a lot on data. In fact, he often said, in God we trust, everyone else bring the data. So it drives decision making. So data is a part of what we're doing here as well. And ultimately, our objective with this new initiative relative to the invitation of Baltimore is to go from being paper-based to paperless in Paterson. Save money and become more efficient and accountable. But that's for another day. At this time, we hear from our councilman from the 5th Ward, the Honorable Louis A. Velez.
All stand for action. So I'm going to try to speak from my heart. Way before I got elected, I saw the problem in the city happening. This is a natural problem. The bigger the city, the bigger the problem. We are a small city, and we are the 3rd largest city in the city of Jersey, but we got a big problem. We can't do it by ourselves. That's why I always call the county and call the state to join us. We have used $1 million, and half of it is working. So we need more funding to be able to put this program where it's supposed to be, in the hands of the people in need. I have the cards and the literature of RealFix in my car. And because I'm boots in the ground, I go everywhere in the city And if I see a homeless or a person that I have to interact to get them help, I give them that card in both languages. Because we have to be accessible to them. And to be able to be accessible to them, you have to be in the streets. This is not a problem for one person, this is a problem for all of us. We need to work on it and continue working on it. He stated, stop suffering. We are people of passion in politics and compassion in the needs of the people. And we want to be able to do that every time that we interact with people in these areas. Damas y caballeros, nosotros somos políticos, pero también tenemos compasión sobre las personas que nos llegan a nuestra carretera con problemas de opio y problemas de droga y adicción. Nosotros estamos para él. Él dijo que paren de sufrir. No es necesario que usted esté en esa pesadilla que está atravesando. Paren de sufrir. Llamen 88 RealFix. RealFix, Real Solution. Real arreglo, real solución. Que es lo que queremos en nuestra ciudad. And we invite anyone, I am going to say that, anyone that want to put money like Bloomberg to us, you're welcome. Because it's going to go to a real cause. And then, in the future, we could be self-dependent, budget for that, and making sure that the people in need get the result that they need. I need to say this, Mayor and Council President. I call the surrounding cities or towns that are surrounding Paterson. You need to bring also RealFix to the city. We are a county seat, and our county seat serves 16 municipalities. Those 15 remaining municipalities needs to bring a RealFix to their city, and probably that alleviate our situation also in Paterson. Regarding the drug dealers, we all know that Paterson police and the law enforcement need to do their job. Because they do their job, we fix the other situation the other end. Thank you for the meeting to be here and always caring about Paterson.
Thank you. Before we close, I just want to make one thing unequivocally clear. Taxpayers are not funding this program. In fact, they're not even funding his position, the Chief Innovation Officer. Again, like I said, divergent thinking, doing things differently. There is a philanthropic organization, the TAP Foundation, that pays the Chief Innovation Officer's salary, so we don't rely on the general operating budget. The RealFix funding comes from $1 million grant award that we won for Bloomberg Philanthropies. So we're talking about people who care about Paterson to fund a position and to fund a program. I started off by saying the parameters were that to come up with an innovative idea to address a challenge only exacerbated by the pandemic. Well, as you know, the pandemic took a heavy toll, an emotional and physical toll on many people, especially the most vulnerable. And what we did during the pandemic, using data, of course, as well, monitoring the infection rate and hospitalization rate to drive decision-making here in Paterson. We saved lives. We saved a lot of lives in Paterson, countless lives in Paterson. But it didn't end there, because we still have work to do. We saved people from an infection. Now we're saving people from addiction. Thanks for joining us. Yes, Pat.
Can you talk about the participating warranties, like how this works, like that 90-minute or less response, who delivers the drug to them, and also if this also covers the treatment, the counseling, and everything. So these 139 people, whatever they took was paid for by this grant?
So actually, no. $1 million only goes so far. A lot of people have insurance, and even those that don't have insurance, there are avenues by which we connect people to the uninsured. So no, $1 million doesn't pay for the treatment. The treatment is paid for by insurance and other grants. And so thank you for asking that question, because I'd like to say that, if you have insurance or don't have insurance, If you have legal status or don't have legal status, it doesn't matter. We can get you into treatment. So don't hesitate to call. What was the other question?
So
Oh, the pharmacies, the pharmacies. So that's actually a very funny thing. It's like there's so many little friction points in the system that keep people from getting what they need. You know, these gears of the system have always existed, but nobody ever forced them to work, you know, seamlessly together. So, you know, we've contacted the pharmacies. We've confirmed that they carry the proper medication in the proper dosage, even the proper brand, because I hate to say that I've become a Suboxone sommelier. It's like I know which of the good generic brands and which of the brands that my clients don't like. So, you know, we work with the pharmacies to make sure that they carry the brands that our clients will take. Because if it's a generic that gives you a weird kind of buzzing feeling, they're not going to take it. And so I'm not going to send somebody to that pharmacy. So yeah, we partner with the pharmacies. We find out that they have proper medication, and some of them provide delivery, and some of them we are contracting with them to expedite delivery. We actually give them like a little surcharge, so that we do pay for. That we pay for expedited delivery because the client doesn't want to go there to pick it up in person. A lot of clients like to pick it up in person for some reason. And by the way, we are talking about buprenorphine. The brand name most people are familiar with is Suboxone. Medication, most people think about medication as methadone. Methadone is, I would say, an old school medication for addiction, you know, and unfortunately there's a great deal of inequity. We find that in rich communities, methadone, you know, goes with good insurance, and we wouldn't be taking methadone, we would be taking buprenorphine. For some reason, in poor communities, 97% of the people getting medication-assisted treatment were getting methadone, which means that they had to go to the methadone clinic every day. And I don't know about you, but I don't even like stopping for coffee every day, you know? So that you can't live a life if you have to go into a treatment center every day for your dose. That's why we are trying to, you know, have an equitable approach to making sure that the best medication, the best brand of medication is available and available on the dose.
how long does Suboxone hold them for before they start doing?
Generally, well, another great question, because one of the things that we're finding is a lot of treatment providers are underdosing their clients, right? Is that, you know, the starter dose is supposed to be 2 8 milligram strips, 1 8 milligram strip twice a day. In other words, 16 milligrams per day, going up as high as 24. We find many providers that are not experienced, that are not following evidence-based medicine, are underdosing their clients, and so the clients are taking Suboxone, they're still finding that they're in withdrawal, and they're failing out of treatment. And that's a real shame, because they feel that they have failed. But our finding is, more often, the treatment center has failed to provide evidence-based medicine. So half of what RealFix is doing is vetting those treatment centers, and those that are not following evidence-based medicine, we don't direct clients there, and we do coach those treatment centers on evidence-based practices, and once they adopt them, then we start sending patients there. So that's a very important point. So for those that have tried, you know, Suboxone or buprenorphine and said it didn't work for me, I still felt like I was going through withdrawal, trust me, you probably weren't getting an adequate dose, and you should call us and we will connect you with somebody that's going to give you, you know, an adequate dose, an evidence-based medicine proper dose.
Is the hotline available now 24 hours already?
Yes. So we have, you'll either speak to a patient advocate right away, who is a trained social worker of substance abuse or a certified peer recovery specialist. And when I say peer recovery specialist, that means these are people who have had addiction in their background. These are extremely empathetic people. There is no judgment when you call 833 RealFix. You might, if one of those treatment advisors is not available immediately, you will speak to a different call center representative that will take your message, and you will have a patient advocate call you back within a few minutes. So, but again, we have people with addiction in their personal history, so expect empathy from us.
Thank you.
That was another question. Was that Kate?
No.
I want to actually dovetail on this question posed earlier relative to funding, because we got to talk about future funding, because Ed said himself, $1 million can only go so far. So there was a major opioid settlement, and we're devising a strategy to use that money, and we're talking about millions of dollars, to continue to fund RealFix. We also would like to see, because I stated before, we want other municipalities to see this as a model for them to emulate. We want to see in the state budget, potentially, and Ed's been working on it, where there would be a line item earmarked for RealFix. And not just for Paterson, but for other municipalities. You want to tell them?
Yeah, so really, thank you, Mayor. Yeah, what we're actually proposing is something of a franchise model. You know, RealFix, the capability, the phone number, the website, the proprietary software that we've developed to crowdsource the teledocs, that would be available to any municipality that adopted RealFix on sort of like a franchise basis. The municipality, though, hopefully would identify a call center person. So if, for example, Clifton wanted to adopt this, or the city of Passaic, or South Jersey, somebody in Camden County, the phone call would come into 833 RealFix. They would say, hey, I'm from Camden County, or I'm from Clifton, and they would be directed over to the appropriate healthcare advocate in their locale. So that's how this could scale up, statewide and nationwide. That franchise model, we will maintain the calls at the 833 number and the software. Local municipalities could join on. And by the way, I have to say, that local presence makes all the difference in the world. Understanding what the friction points are of the people in your city makes all the difference. We spoke about, ID. That is something that most health departments can help the homeless and those in the community get ID. And ID is something that can prevent people from either getting into treatment sometimes, not us, we get past it, but we get them their ID. Insurance barriers, housing barriers, these are things that need to be addressed locally by our local presence. But we have to have this overarching methodology that facilitates that these gears of the system work seamlessly together and people get what they need on demand. Because if there's one thing that I've heard from those people with addiction, when they ask for help, the window of time in which we have to respond closes very quick. If you don't deliver that help within that window of time, you will lose them for months, if not years. And we can't afford to lose anybody. So, I invite other municipalities to call 833 RealFix, ask how they can be, joined into this program. And we were set up with the intent of doing that. Frankly, Bloomberg Philanthropies would not have funded us if we did not have the intention to go nationwide.
I like that. And I want to dovetail on that because, yes, we do lobby our legislators here in New Jersey, but quite frankly, yes, this is a nationwide epidemic, and something should be built in or baked into the federal budget to fund a RealFix program for everyone in America.
We get people from everywhere. I'm just going to, I would like to add the full number, which is 833-732-5349. And the reality is that here in the city of Paterson, we're getting people from everywhere throughout the state of New Jersey. In my personal experience, I asked some people that are addicted in the community, where you came from? Oh, Atlantic City, Morristown, from every different city. So it's important that the city, get into this model and start helping the community as well. Y el teléfono es 833-732-5349 y este programa va a ser 24/7. Es importante que aquella persona que tiene problemas de adicción llame a este número porque se ayuda.
Thank you. Thank you. Yes, Matt, sorry.
As the council president pointed out, unfortunately, Paterson has a reputation for being a drug here on the East Coast, right? So you get people here from all over. Is this for only the people from Paterson? Like if I'm here and I'm on the streets?
If your feet are in Paterson, this program is for you.
Yes.
So we are trying to expand to the county. We are applying for county money to get some hard dollars to transport people from the rest of the county into treatment. And by the way, once in treatment, back home again, right? Because, we do have, unfortunately, too much opioids in our city. We also have a lot of treatment centers in our city. And when people come here for treatment, they need a way of getting back home. Because that's also, like I said, all those friction points. It's kind of ridiculous, right? Because you could go into treatment and you could be done with treatment and it's like, how do I get home? You have to have a way back home, right? You have to have a way back to reunite with your family, to get into housing. But staying on the street, I've heard from my client, being on the street and staying straight don't work. So.
That you raised a very salient point relative to Paterson in the past being considered a drug hub, because we want to be a destination for the right reasons. Next month, we will be unveiling the totally transformed Barber Park. If you're not familiar with Barber Park, at one time that was notoriously known as Syringe Central. It was a drug den. The community took back the park, and now we're going to splash pad and all of the equipment that is befitting what children deserve in the city of Paterson. And then the following month, we're taking back Flint Street Park, again, another drug den, Syringe Central. So we're not only helping out these individuals' rehabilitation, but we're also offering opportunities for individuals that were in areas, neighborhoods that were neglected for far too long. Thank you. That's it, Pat. We got you. Here.
It's all good.
Okay.
Great.